After this guy gets a hip replacement, I'm sure he'll look back on this social media post and look at all the likes and shares and be like, dude, this was so worth it.
So we'll circle back and address this viewpoint in a second. But we first need to clear up a common misconception about hip replacements. Needing your hip replaced is not an age-related thing. Yes, so many people as they get older tend to require a hip replacement because the hip joint has become so dysfunctional that is the next logical step. But we need to get out of this thinking that it is a normal part of the aging process. It's not. And while a hip replacement may be the next logical step for so many people, we need to stop short of calling this normal. Common, yes, and a valuable next step for so many people. But as human beings, our joints shouldn't wear down just because we're getting older. Instead, if we have accrued hidden dysfunction, stiffnesses, tightnesses, relative weaknesses, poor mechanics, poor postures, and over decades we begin to load up a specific joint differently to what the manual describes, then that joint may start to wear down, become dysfunctional and painful if given enough time. But the important thing to understand here is that we need to try and cultivate normal flexibility, normal strength, and normal loading of the joints. And we need to stop talking about things like use and overuse along with age as being the cause of this joint dysfunction. And it's this hidden, covert mechanical dysfunction that we take into interesting things like running, playing sports, using our tissue over time that can get exposed and eventually create the need for that hip joint to be replaced. So if we circle back to this original video and we see a person strengthening their hips through a full range of motion, albeit probably a greater range of motion than you or I currently have available to us, to suggest that someone who is just trying to cultivate strength through their entire available range will somehow lead them to a hip replacement down the track is missing a very important and necessary perspective. Where are the restrictions? Where are the weaknesses? Where are the poor mechanics that may be changing the way that you load up that joint beyond getting older and using it? Because when dealing with pain and injury, the language that we use matters. You are allowed to use your body. You are allowed to express full range of motion. You are allowed to get older. And you are allowed for your hips to survive that process without needing to be replaced at some point.